Almost every MBBS student loses marks in the thyroid hormone question, not because it's difficult, but because they don't know the correct sequence to write the answer. What if I show you the exact university answer format that can help you score full marks? Stay till the end because I will share the entire topic exactly the way examiners expect it, from the synthesis to regulation, functions, thyroid disorders, thyroid function test, and important drugs. Let's begin with the introduction. Thyroid is the largest endocrine gland of our body. It is butterfly shaped and located in front of the trachea, just below the larynx. Whenever you get a 10 marks question, always start with a neat and labeled diagram. It immediately creates a good impression. The thyroid secretes major two hormones, T3 and T4. But here, one point we need to mention about high blood supply. Thyroid receives about 400 to 600 ml per 100 grams per minute. Following the chapter outline under which we are going to discuss the entire answer. First one is the functional anatomy, then biosynthesis and secretion, then physiological actions, and lastly about the clinical aspect, hyper and hypothyroidism. Now let's see how this gland is built. Histologically, thyroid is made up of thousands of follicular cells. Now these shows mainly three components. First is follicular cells. Each follicle is lined by these follicular cells, and this cell shape changes with the activity. For example, normally they are cuboid. When they are highly active, become columnar, and when they are inactive, become flat. Second is colloid. These follicular cells are filled with colloid. The colloid stores thyroglobulin, making the thyroid unique because it stores the hormone outside the cells. And last one is the parafollicular cells. Between the follicles and the basement membrane present the C cells, which secrete calcitonin, important in calcium homeostasis. Imagine these follicles as a factory, colloid as a warehouse, and follicular cells as a workers. This simple analogy makes the histology easy to remember. Now comes the foundation of the chapter, that is iodine. Iodine along with tyrosine is essential for thyroid hormone synthesis. It comes in two forms, T4 that is thyroxine 90% and T3 that is triiodothyronine 10%, and RT3 that is reverse T3 is present in less than 1%. This can be represented with the help of this pie chart. Remember, it is interesting to note that the most of the body's iodine is stored in the thyroid gland. Now, sea fish is the richest iodine source. The iodine daily needs is about 100 to 200 microgram, which can be easily taken care by iodized salt. This is one of the most important diagram for university exam. Let's learn the first three steps. Step 1 is iodine trapping. This is mainly done by sodium iodide symporter, or also called as iodide pump. Second stage is synthesis of thyroglobulin. This large glycoprotein is synthesized on the rough endoplasmic reticulum and released into the lumen. Third one is oxidation of iodide. This iodide is oxidized to iodine by peroxidase near the apical border. Remember, thyroid is the only tissue that can oxidize iodide to iodine. Now comes the second half of the process, that is step 4 to 6. Fourth step is organification. Organification where iodine attaches to the tyrosine residue on thyroglobulin and form MIT and DIT. Fifth stage is coupling reaction. This MIT and DIT undergo coupling reaction to form T4 and T3. And the last stage is the storage. It is unique in thyroid as the hormones are stored in a follicular cavity, that is in colloid and not in secretory cells, and can meet body requirement for 1 to 3 months. So remember these three stages. First one is organification, second is coupling reaction, and third one is the storage. This single flow chart is enough to reproduce the entire synthesis in the exam. After biosynthesis, next stage is the secretion and transport. This secretion process involves three stages. First one is the endocytosis. Here the colloid retrieved into the cell via mammalian receptors. And after that, there is a proteolysis. That is, a lysosome digests the thyroglobulin, releasing free T3, T4, MIT, and DIT, which diffuses across the capillaries and enters into the blood. These T3 and T4, once enter into the blood, they are transported in two forms. First form is bound form, about 99.95 mainly to thyroxine binding globulin, and second one is a free form, about 0.05% of T4. Remember, 40% of T4 is deiodinated into T3 in the peripheral tissue. Remember, very important Viva point is which hormone is secreted more, T4, but which hormone is more active, it's T3. This regulation of secretion flowchart is extremely important. It is mainly regulated by hypothalamus pituitary thyroid axis. It begins in the hypothalamus through thyrotropin releasing hormone, which is mainly stimulated by cold and stress. This TRH acts on antipituitary gland and produces thyroid stimulating hormone, which increases the hormone synthesis. Now, these high plasma levels of T3 and T4 produces negative feedback effect on antipituitary gland and hypothalamus through TSH and TRH release. And finally, there is autoregulation. That is, the gland adjusts to the dietary iodine. Whenever there is low dietary iodine, it produces a super efficient trapping mechanism. Remember three important stages: hypothalamus, antipituitary, and thyroid gland, and their respective hormones TRH, TSH, and T3 and T4. Thyroid hormone does not have a single target organ, but it affects almost all body tissues by altering a gene expression. Unlike other peptide hormones, thyroid hormone enters the cell. Especially, it enters the nucleus, binds with the thyroid response element, and causes transcription of mRNA. This produces three cellular results. First one, increase in the synthesis of enzymes or protein, increase in sodium potassium ATPase pump, and increase in number and activity of mitochondria. So, in general, increases the metabolic activity. Remember, when asked about this mechanism in the exam, always draw this diagram. It makes your answer stand out. This slide explains why thyroid hormones are called the body's metabolic accelerator because it increases basal metabolic rate, produces increased oxygen consumption and heat production. It plays an important role in growth and development, especially normal myelination of the nervous system in the first year of life. It increases glucose absorption, mobilizes fat from the adipose tissues, and for protein metabolism, it is anabolic in effect in normal amount and catabolic in excess amount. Remember, this thyroid hormone having calorigenic effect. Think of thyroid hormone as a body's accelerator pedal. Let's revise the system-wise effect. First, the cardiovascular system. It causes increase in heart rate, cardiac output, and pulse pressure. For nervous system, it enhances wakefulness, alert, and memory. For GI tract and respiratory system, it increases appetite, GI motility, and increases ventilation. And for reproductive system, it is important for fertility. So lack of it, it causes impotence in men and menorrhagia or amenorrhea in women. Now let's move to the clinical physiology about hyperthyroidism, where there is increased secretion of thyroid hormone. The most commonest cause is Graves' disease or toxic goiter. This is an autoimmune disease where antibodies mimic thyroid stimulating hormone causing glandular hyperplasia. The signs and symptoms include raised BMR causing marked weight loss, heat intolerance, excessive sweating, and tachycardia, tremors, and nervousness. Remember, here goiter and exophthalmos are the two important major symptoms of this Graves' disease. Now think in the opposite direction, that is hypothyroidism, where there is low levels of circulating hormones. It shows two distinct clinical syndromes. First one is the cretinism. It is seen in infant and it is characterized by retarded growth, pot belly, flat nose, protruding tongue, mental retardation in some cases if not treated properly. Second syndrome is myxedema, which is seen in adults. This is characterized by weight gain because of lower metabolic rate, cold intolerance, bradycardia, lethargy, and most important, dark thick skin, sparse hair, and myxedematous tissue infiltration. This comparison table is one of the highest yield slide between hyper and hypothyroidism. In exam, always draw a comparison table. It's faster to write and easier for examiners to evaluate. So let's see one by one about the hyper and hypothyroidism. First point is BMR. BMR is increased or high in hyperthyroidism and low in hypothyroidism. Weight. There will be weight loss in hyperthyroidism and weight gain in hypo. Temperature is heat intolerant in hyper, cold intolerant in hypo. Heart rate. There is a tachycardia in hyperthyroidism, bradycardia in hypothyroidism. Skin. It's sweaty and moist in hyperthyroidism, whereas a dry and toad skin in hypothyroidism. And lastly, about the CNS, it is restless or tremors are present in hyperthyroidism and it is lethargic in hypothyroidism. One important clinical similarity is also seen between the catecholamine and thyroxine effect. Both increases BMR and heart rate. But remember, catecholamine, the effect is rapid and short-lived, whereas thyroxine, it is slow and for long duration. This is one of the most favorite topic for Viva, thyroid function test. It is done with the help of three clinically important tests. First one is the blood level. In this, free T3, T4 and TSH blood estimation is done by radioimmunoassay and ELISA. Second test is radioactive iodine uptake. Here the traces of iodine 131 or 123 is given orally and radioactive iodine uptake is estimated. In normal condition, it is 20 to 40% at 24 hours. Hyperthyroid, it is more than 60%, and hypothyroid, it is less than 20%. And third clinically important test is scans or UAG. It is used to detect hot, functioning, or cold, non-functioning nodules. Let's finish this answer with the pharmacology. Antithyroid drugs. These antithyroid drugs, it reduces the secretion by blocking specific synthesis step. First one is inhibiting iodide trapping. Drugs like thiocyanate, perchlorate, it competitively blocks sodium iodide symporter. Second one is inhibiting oxidation and coupling. Drugs like thiouracil, carbimazole, it inhibits peroxidase enzyme. Third one is inhibiting hormone release. Here, the large doses of iodine, it paradoxically decreases release of T3 and T4. This is called as Wolff-Chekhov effect. Congratulations, we have finished the complete 10 marks answer on a thyroid hormone. Before you enter the examination hall, remember this answer sequence. We have started with the definition of the thyroid hormone, then about the diagram of the thyroid gland. We have seen the histology about the synthesis of thyroid hormone, then the storage of thyroid hormone. Then we have seen about the transport, the regulation of secretion, then mechanism of action at the intracellular level, then various physiological action on metabolism and growth, their various functions on different systems, and about the clinical correlation. Here we have seen about the hyperthyroidism, hypothyroidism, and lastly the most important, very important question, that is about the thyroid function test. If you write your answer in exactly this sequence with neat headings and diagrams, you will present a structured university answer that is easy for examiner to follow. If this video helped you understand how to write a complete 10 marks university answer, don't stop here. Watch the next two videos in this series. Thyroid hormone in 5 minutes for rapid revision before exam, and thyroid hormone made easy for flowchart and memory tricks you will never forget. If you are a first year MBBS student aiming to score higher in physiology, subscribe to PhysioWithNeo, where every university topic is taught in 3 steps: master, revise, and remember. See you in the next video.